Needlescopic or mini laparoscopic surgery is a new procedure here in New Mexico. We're talking all about it today. Dr. Eldie Cruz is a surgeon with Lovelace Medical Group who has 500 procedures for gallbladder surgeries using this technique. Doctor, good morning. It's good to see you.
Good to be here.
Thanks for coming in. So let's talk about this. I think Liz is kidding around with the anesthesia part before. You do have anesthesia, but what are these instruments and how is this helping with the surgery?
So I've got some props here, and these are just to show what traditional laparoscopy is, surgery with a camera, where we make incisions anywhere from 5 to 12 millimeters. And traditionally, you put these through the abdominal wall, and they sit there so you can pass instruments in and out, roughly about this size.
So you're sticking something that is... can I touch this?
Yeah, you can touch it.
Okay, something this big through the stomach wall. That's a pretty big incision.
Yeah. So somebody came up with the idea of, can't we just make it smaller and not require one of these? So they inserted an instrument into a large gauge needle. And
okay, it works, we promise.
Yeah.
So obviously that cuts down. I mean, I can't even imagine how many times smaller that incision's going to be for the new equipment than the old one.
This is 12 millimeters, and this is 2.8 millimeters. So.
There you go. That says it right there.
Yeah.
So in terms of what you're able to see, is it the same with the new surgery?
Well, no, you still have to put at least one of these ports in to put in a camera.
Okay.
And the gallbladder is about the size of your thumb, so you still need an incision to take it out. You can't take it out through this.
Okay.
So what this does is cuts down on the amount of large incisions. Traditionally, you requires 4 incisions.
Okay.
The biggest one being about this big, and then some additional ones for working ports are 5 millimeters, which are about this big. So it's still half the size of the smallest port traditionally used.
Okay.
So these don't even qualify as incisions. They're needle pokes, basically.
Yeah,
and when they heal up, they look like a freckle. So if somebody's worried about cosmesis, it's...
Okay, so when you talk about the reason why smaller incisions are better, you talk about the scarring issue, and I imagine the risk for infection goes down as well.
Oh, it goes down a lot. Also, the post-operative pain goes down a lot. If you can imagine me torquing something around this in your abdominal wall.
I get
versus, a tiny little thing like this. So they're pretty strong. I mean, they hold up to like 300 grams, which is...
How long have you been using these on patients here in New Mexico?
Well, I just started. I'm originally from New Mexico, and I worked in Washington for 4 years, and I've been back for about 9 months, and so I've been doing it here for about 9 months. So.
Okay, and how is it going? What do patients think of this?
Oh, I mean, they love it. I mean, they come back and they're surprised. They're like, why is there glue on my skin out here? Because we use it to close it, and I'm like, well, there was an instrument through there. Really? I thought somebody just dripped glue on me. So.
Oh my goodness! Yeah, that's after they wake up.
Yeah,
from the surgery.
Well, no, that's like when I see them in a week.
Oh,
so, the glue stays on for like 2 weeks, and they can see their big incision where the gallbladder came up through their belly button.
All right.
But they have this little drip of glue out on the side, and they're like, "Why did you put glue out here?" Because they can't really tell that there's a needle poke there. So.
Okay. This is really interesting stuff. You want to find out more about it and how Lovelace is using it, you can head to our website, KASA.com. Click on the KASA blog. All the information is right there. You can get in touch with Dr. Cruz. Thanks for coming on, sharing all this this morning. I appreciate it.
Thanks for having me.
It is our pleasure. Glad you're doing this. And, anytime you can get people out of the hospital quicker and make surgery easier, it's a good thing.
And then recovery, it's always, my goal is the best recovery that they can have. So this makes it nice.
Without a doubt. Thank you, Doctor. Appreciate it. Again, KASA.com for all the information.